Hello, good evening, Mohua. Good evening, Vikramjit. Good evening, everyone. We'll begin shortly. Let's just wait for 2 to 3 minutes for others to join in. And welcome to another webinar facilitated by Daily Bloom IBS. Uh, I am Solanky Paul, and I'm a psychologist and a wellness coach of Daily Bloom IVF. And today I will be facilitating the session. So let's just wait for a couple of minutes and then we will begin. Thank you. So the webinars that we usually hold, this happens every week on Saturday, where our nutritionists and wellness coaches take this. So today, I will be taking your webinar, the wellness coach. Also, along with that, the nutritionist also take the webinar. And over there, we get to know more about the physiological aspect of IBS and how we can deal with it. Today, you will get to know about the psychological aspect of it. Along with that, we also hold some live patient interview where we go through the journey of every patient. Okay. And along with that, I would ask you to also drop some questions if you have some doubts in between the webinar, and also you can drop questions before that as well. So you can drop the questions in the chat box. Okay. Also, along with that, you guys are already familiar with the fact that we also do YouTube live sessions with yoga, where on every Monday, Wednesday, and Friday, where you can join in, and there is a yoga trainer expert who takes the session, and you can also see that and practice yoga from. Okay, let's just wait for 1 minute and then we'll begin. Good evening, everyone. I hope you all are having a good day till now. And I hope with this webinar, you will have a more better day. So hoping to do that. Oh, let's begin. Thank you for your patience so much. And again, I welcome you all to another webinar done by Daily Bloom IBS. I am Solanky Paul. I'm a psychologist and a wellness coach of Daily Bloom. And today, the webinar's topic is on the link between sleep and IBS, that is, managing symptoms with sleep hygiene. Okay, so let's begin. If you, anytime at any point, if you don't get to hear me or you have any problem, do drop a text and I will see it from there. Okay, thank you. So what's in our today's agenda? So the first thing that we'll get to know is what is IBS. Then the next is IBS and gut-brain axis. Third is the relationship between IBS and sleep. Next, relationship between sleep and overall well-being. Next is what is sleep hygiene. And at the end of the webinar, I will introduce some sleep hygiene strategies that you can incorporate in your day-to-day life so that you can also practice the sleep hygiene techniques accordingly. Okay. So before I begin, I would like to pose this question to everyone who are there in the audience section, like what do we understand by the word IBS? Like whatever that comes to your mind, you can answer this in the chat box, and I would appreciate a very active participation from you all. Anything, whatever that comes to your mind. I know we most of you already have 1 or 2 sessions with the nutritionist or with your wellness coach, so you are already aware about the term or know something about it. So anything that is coming to your mind, or the symptoms that you guys are facing. Okay, I'm not seeing any responses in the chat box. So either you guys have already slept off, or probably you want me to move on. So can I expect any reaction from you guys? Okay, then moving on with what is IBS. So with the definition, okay, someone has already answered. Thank you, Suvarna. It is irritable bowel syndrome. Okay, and also if anyone else wants to answer from their own part, you can also please use the chat box to answer over there. So as we know, the full form of IBS is irritable bowel syndrome, which is actually defined by a chronic or long-term functional condition that affects our gastrointestinal system. So usually there are 3 types of IBS, that is IBS-C, IBS-D, and IBS-M. So IBS-C is actually known as IBS constipation, IBS-D is known as IBS diarrhea, and IBS-M is known as the IBS mixed syndrome. So someone has wrote, okay, Ashok Swami has wrote, if the doctor does not know the reason of the problem, okay, they call it IBS. Yes, Ashok, you are right in some way, because there not been a diagnostic biomarker have been found for the causal factor for IBS. So that's why doctor can't exactly pinpoint the exact factor of it. It's actually a mixture of physiological and psychological causes that actually like come down and cause IBS. Thank you for your answer. And also, then next is individuals. So I was talking about IBS-D, that is IBS diarrhea, and IBS-M, where we are having the symptoms that are both mixed, that is constipation and diarrhea. But in all the scenarios, individuals with IBS often experience abdominal pain. So there is a change in the bowel habits and in our digestive process. Okay. So moving on. So IBS is closely related to our gut-brain axis. So most of you are already aware about the gut-brain axis. You already have seen it in the Daily Bloom IBS app also. Over there, there is a beautiful video given over there explaining the whole communication process. So I'll just brush upon that. So gut-brain axis is a two-way system where our brain and gut communicate with each other. So it is a communication system between the digestive tract and the brain. But when IBS is present, the communication within this axis becomes disrupted. So there is some miscommunication that is happening, which is leading to problems in our digestive system. So for that, you will see also like altered gut motility. So what is altered gut motility? It is actually where our food is moving at a pace that is not normal. So either it is moving fast, which is happening in the case of diarrhea, or it is moving slow, which is happening in the case of constipation. Okay. Then next is imbalance in microbiota. So in our gut, there are a lot of microbiomes, a lot of bacteria that actually breaks down the food to help us digest the food accordingly. But when when we suffer from IBS, so this gut-brain axis actually get disrupted. So because of that, there is an imbalance in the number of bacteria also present in the stomach. So that also leads to our indigestion process. Okay. Next is improper functioning of immune system. So sometimes people always talk about inflammation. So over here, our immune system is also getting hampered where there is an overreaction or underreaction of immune system. When the overreaction is happening, then inflammation happens. And because of inflammation, we also feel this cramps or muscle cramps in our stomach or the spasms. Okay. And lastly, misinterpreting pain signals. So when our gut brain axis is disrupted, the messages, the neural messages that is going to our brain is not regular. So when we are digesting our food, what happens is that our stomach muscle or the intestinal muscle do contract to digest the food and pass the stool. But that is called peristalsis, and that is very normal. The pain is not there. But when this gut brain axis is disrupted, this pain stimulus getting to our brain is very high, and we are at a heightened sensitivity to sense this pain. And because of that, we suffer from abdominal pain also. So it is because of this heightened sensitivity, even the normal bowel movements can cause pain, and that can also have a disruption in your sleep as well. Okay. Then next, moving on. Now coming to the relationship between sleep and IBS. Now, problems in the gut can affect sleep by disrupting the nervous system, which in turn affect our sleep quality. So, as I was discussing earlier, so this gut-brain axis, so when it is disrupted, the fact that the messages that is going to our nervous system is at irregular levels. And because of this, we are getting misinterpreted pain signals that can cause sleep disruption. It can even hamper the quality of sleep. Now, there is a two-way cycle over here. When we are not getting sleep, the chances are high that your IBS symptoms also can get flared up. Because when we are well rested, chances are high that your body can restore and can replenish the problems that your body was already having. But as you're not getting sleep, chances are high that the IBS symptoms that are present in your system will have a more effect on you. So poor sleep can also make IBS symptoms worse. Okay, now moving on to the next part. So now I was talking a lot about sleep and IBS. So there are some challenges that we face during our sleep. So I would again ask all the audience to answer this very simple question. What are the common sleep challenges faced by you due to IBS? Or even not due to IBS, even just the common sleep problems that you guys face. I would like everyone to use the chat box right now to answer this question. Okay, someone has wrote overthinking. Yes, overthinking can actually cause problems in getting to sleep. Thank you, SK, for answering. Okay, thank you, Subarna. She has written bloating, active brain. Okay, no sleep issue. There is acidity, bad dreams. Okay, there are a lot of answers coming over here. Yes, you all are correct. Sometimes when we get acidity, bloating, yes, it cause problem in getting to sleep. Same time when we are overthinking or we are worrying about something, that can also hamper to get you to sleep. And if you are thinking about something, that might also go into your subconscious state, which can cause certain dreams that you see at night. Okay, someone Bikramjit has written quality is good, but overall time of sleep is interrupted sometimes. Okay, interrupted sleep. Okay, thank you everyone for being so participative. Okay, so the common challenges that are faced in IBS regarding sleep are insomnia, that is not being able to fall asleep. Next is waking up during the night. So a lot of times we do wake up during the time and we have difficulties again to go back to sleep. So that is something that we commonly face when we are dealing with IBS. Next is daytime sleepiness. So when we are not sleeping at night properly, chances are high that you will feel the fatigue throughout the day. And because of this, you will feel a lot of daytime sleepiness as well. And lastly, feeling less rested and getting less refreshing sleep. So if it happens in a pattern, chances are high you will feel less rested, and even when you wake up after you have fallen asleep, you won't feel that fresh. Okay. So why do we like have difficulty in falling asleep? So whenever we have this pain in our gut, stomach, so this pain is inhibiting us to sometimes fall asleep. If we are suffering from diarrhea or constipation, then again, the chances are high that you will face difficulty in going to sleep. Okay. Someone has written, if sleep is broken, can't go back to sleep. Yes. If the sleep is broken, sometimes we can't usually go back to sleep. This is a common problem that we usually face. So we'll talk about some sleep hygiene strategies over here that you guys can also incorporate. Okay. Now, coming to the fact that why is sleep so important? Can anyone tell me, like, why we focus so much around sleep? Like, why it is so important? Like, for your overall well-being, for your IBS, for your curing of IBS. Some people have also heard from your wellness coaches or from your nutritionists as well. They ask you, how many hours do you sleep throughout the day? Like, why is it important? Why do you think so? You can use a chat box for this as well. Okay, someone has written, is there any correlation between IBS and frequent urination? Okay, I'll come back to this question in the later half of the webinar when we are taking general question. Okay. Okay, so Varna has written, for healing our body and brain. Yes, we do. Our brain, our body, they do need the time to actually get the rest and to heal. Okay, Mohua has written, nervous system become calm. Yes, our nervous system become calm because at that time it is at rest. Some system might be working, but you are actually giving rest to your nervous system as well. Thank you, Mohua, for answering this. Okay, so moving on, like why it is important. So there is a relationship between sleep and overall well-being. So as Avarna has written, it helps to heal our brain and body. Yes, sleep is an involuntary reaction that is very necessary for us to function throughout the day. Okay. Bikramjit has written, sleep makes your body get back its strength. Yes, it repair and restore our brain and not just our body. Okay, then it is very much related to our mental health as well. It helps us to regulate our moods. Like, I think chances are high when you guys have just 3 hours of sleep and after you wake up, you are in a very chirpy mood. You will probably won't like to talk to anyone. But when you are having a good 7 to 8 hours of sleep, chances will be higher to have a talk with someone, or you won't be that much irritated with starting the day. So why is that? Because our mood is getting regulated while we are sleeping. Okay. Then next, it helps in reducing the levels of stress. When we are stressed, if there is always this problem of us where we have an impulse to act on it or what to do about it, we overthink about it. But if we give time to our body and our brain, chances are high that we can react better to the stress and seeing it from an objective point of view and not letting our emotions get a hold or control of you. Okay. So while sleeping also, you can reduce your level of stress. And lastly, and very importantly, high quality sleep can also help you to build resilience to anxiety and depression. So, whenever you are getting the good night's sleep or the rest that your body requires, you are building resilience. That is your ability to fight back to your anxiety, your stress, and depression. And chances are high that you will react well under very high intensity pressure situation as well if you have a very good night's sleep. Okay. Then moving on, and now coming towards the end. So we have discussed about IBS, about sleep, the relationship, and what are the problems. Now, how we can solve it? Because there should be some solution for it, right? So we have done a lot of research, and it has been found that you can incorporate certain sleep hygiene strategies to actually sometimes overcome these problems. So, what do we understand by the word sleep hygiene? Sleep hygienes are not anything but just healthy habits and behaviors and environmental factors that you can adjust to help you to have a good night's sleep. Okay, it is just changing your behavior bit by bit, your environment to suit your like resting situation and to also have a good night's sleep. So now coming to some of the strategies that we can incorporate, that is number one, stick to a sleep schedule. So one thing is that how can we stick to a sleep schedule? So you have to figure out a time of the day where you are like, I am going to sleep at this time and I have to wake up at this time only. At just wait a second. I will just give me a moment then. Sorry for that. Sorry for that. So we were talking about stick to a sleep schedule. So how you can do that? So firstly, you can schedule a time that is at 10 o'clock or 11 o'clock, you have to go to sleep. And then you count like 7 to 8 hours. Mostly 8 hours is actually good for you. So have that 8 hours of sleep and wake up. Don't sleep more than 8 hours. That is also not good for your health. Okay, so have the schedule fixed, don't change it every day, follow the same timings only. Then next is pay attention to what you eat and drink. So before you go to sleep, don't think that I can go to sleep by having an empty stomach. That is not a good way. And also don't go to sleep by overeating something. So always give time to your food to digest and then go to sleep. Also, substances like nicotine or alcohol are found to be very harmful for our sleep quality as well. So, try to keep that in control before you go to sleep. Next, create a restful environment. Now, how you can create a restful environment? Firstly, you have to see the temperature of your room. So, we can't control that, but usually, if it is cold, it is very good for your sleep quality and dark. No light should be emitted at that time. And another very important thing, don't stimulate yourself with anything that you are seeing from phone. So the light that comes out from your phone or the screen time that you are viewing yourself to is something that is hampering your sleep quality. So reducing your screen time before going to sleep can also help your to improve the sleep quality. Okay. The next three strategies are limit daytime naps. So sometimes when we don't get a good night's sleep, we oftentimes take naps in between the day. That is okay, but don't take it more than 1 hour, because if you are taking it more than 1 hour, chances are high that you won't be able to sleep at night. You won't be fatigued to get sleep at night. Next is include physical activity in your daily routine. So include any kind of activity, even if it is walking, you can do that. That usually helps to get to sleep. And sometimes, whenever we are sleeping or we go to bed, sleep is not coming. If after 20 minutes also the sleep is not coming, you can get up from there, you can move out of the room, you can walk around a bit, and when you feel tired, you can come and sleep again. So that's also another strategy that you can use. Lastly, manage your worries. So somebody has already wrote overthinking. So yes, sometimes when we go to sleep, all the things come down to us, like what was happening throughout the day, what were the problems that went through your mind. So if possible, jot down your worries, have a journal, and then listen to something that is soothing to you. Do a breathing exercise, calm yourself, so that the sleep hormone melatonin gets released and you will be able to sleep. Okay. So with that, we come towards the end of the webinar. So the Daily Bloom actually provides certain features to help you to curtail the symptoms of IBS. That is number one, with nutrition. That is the health coaches will provide you the personalized diet plans and recipes. Next, the wellness coaches will provide you with certain relaxation activities and stress management activities. Along with that, you will get certain resources like yoga videos, articles, and also symptom tracking, so that we can also get a hold like how much is your improvement throughout the entire journey. Okay, so that's all from my side. I hope you all have enjoyed the webinar. So now we will be taking any questions. So anyone who have any questions, please do type it out in the chat box and I can get through it. Okay, anyone who has any question, you can type it out in the chat box. Okay, someone has written, are dreams good? Okay, it depends on the dreams. If you are seeing a good dream, that is okay. So dreams are something that's in our subconscious state of mind. It is something that probably is going through your head through the entire day, or something that happened very previously. So it depends on the dreams. If you're having nightmares, that is something that is not good for you. And probably doing a relaxation exercise or a breathing exercise might help you to control those as well. Okay, so someone has written, is IBS completely curable? Okay, so we usually say that it is not curable, but it is completely manageable. As I have said in the beginning of the session, that as a cause is not fully identified, there is no biomarker for identifying it. We can manage the symptoms. How we can manage the symptoms is by making these lifestyle changes. One, you can maintain your diet plan. Along with that, you can incorporate the physical activities, and with that, these actionable strategies that are being given to you, if you do that, chances are very high that 90%, like 80 to 90% of it can be fully manageable, and you won't like get recognized with the symptoms of it later in your life. Okay. Someone has written, what is method control anxiety? Okay, I'm not getting your question, Rajendra, someone. I think you are asking about, is there any method to control anxiety? Yes, there is. You can do any kind of breathing exercises like box breathing, progressive muscle relaxation, or guided imagery that usually help. Also, writing down your worries, like the things that you are anxious about, can also help you to get an objective point of view. And that's a form of expression also, that you can think back, okay, this is something that was worrying me about. What's the root cause of it? And once you identify the root cause of it, you can manage it as well. Okay, someone has written how to reduce stress. It is very, very tough. Okay, yes, it is very tough to reduce stress, but again, it's a gradual process. Okay, so it will take some time, but if you incorporate in certain activities that are being shared to you, then and if you maintain a schedule, a routine to it, chances are high that the daily stress would be manageable. Now, even after that, if it is not manageable, then I would request you to visit a doctor, like consult a doctor and see what are the symptoms that you are having. Okay, someone has written, ma'am, I'm not sleeping well for the last 3 nights. Okay, then the strategies that have been discussed over here, please do incorporate this and then see if it is happening or not. Okay. All time overthinking is going on, Mohua has written. So this is the last question that I will be taking in. So when you are overthinking, there is a very good way to stop overthinking is by doing this grounding technique. It's called 5 4 3 2 1. So how you can do it. So whenever we are overthinking, we are mentally absent from our present situation. So how can we become again mentally present? So you have to hone in your five senses. So the five things that you are seeing in your present surrounding, then the four things that you can touch in your present surrounding, you have to mentally jot it down. Then the three things that you can hear, two things that you can smell, and one thing that you can taste. So these are like the five senses. You are activating your five senses, and you can also go in detail. So in this way, you're cutting down your thought process and you are again making yourself to be mentally present. Okay. Okay. Thank you everyone for being so participative and asking this question. I hope you all have enjoyed this webinar and have gotten some takeaway from it so that you can incorporate it in your daily life as well. Thank you.